May is Mental Health Awareness Month. The goal here is to bring attention to mental health issues and reduce the stigma. There's a greater focus this year as the pandemic has left adults and teenagers feeling very stressed, depressed, and isolated. But there are tools right here in Connecticut right now to help you check in with yourself or get the all-important help that you may need. Joining us this afternoon is Tanya Barrett, the Senior Vice President of 211 Health and Human Services. Tanya, thank you for being with us today.
Yes, you're welcome.
So many people may be struggling right now with their mental health, really for the first time. What kind of symptoms should we be watching out for?
Yeah, mental health is such an important but often forgot about component of health. And we get reminders in the mail for, our 6-month dental checkup or our annual physical, but we don't get a reminder that it's time to check in on mental health. And I think Mental Health Awareness Month is a great opportunity to check in. Understand how you're feeling, if you're feeling stressed or anxious or worried. These are important symptoms to catch while they're still small, before they boil over. Also checking in on what you're worried about the most and what you can do to address your worries and avoid triggers and patterns of negative thinking. Take care of your body. One of the biggest things is getting enough sleep. Getting enough sleep, eating healthy, and exercising can really change your entire mood and how you relate to others. If there are things in your life that bring you joy, make sure that you're doing them and that you're carving out more time for things that make you feel happy, and some of those things could be as simple as taking a walk, taking a break, taking a bath, and spending time with friends and family. And then, lastly, make sure you have good people in your corner. Have someone who encourages you, who listens to you, and someone who you can go to for advice and support. Someone that truly has your best interest at heart. And, if you don't have that person in your life right now, there are support groups, and support groups are great ways to make connections to other people.
Yeah, it's certainly good to talk with other people for sure, but what should we watch out for, perhaps in ourselves or in a loved one, that could be a sign that, some help could be needed?
Yeah, if you're concerned about someone, please check in on them. Some of the common signs of mental health problems are depressed mood, excessive worry, stress, and anxiety. If you see that someone's experiencing rapid mood swings, they're having big changes in their behavior, they're withdrawing socially, so they're isolated, they're using substances more, they're engaging in risky behaviors more. In children, sometimes we see it with behavioral issues. Poor grades can be a sign, and poor grades when people are trying hard is another sign. Hopelessness and then suicidal ideations is probably the big thing to pay attention to and take seriously.
And I do want to ask you, because obviously 211 is an incredible resource, and it's really that easy, right, to get a hold of someone who you can talk to and can potentially hook you up with some assistance?
Yes, people can dial 211 and get connected to us for crisis intervention. Last year, we actually handled 125,000 crisis calls, and 94% of those callers reported that their state of crisis was diminished by just talking to a 211 contact specialist. Less than 1% of the calls actually needed a 911 active rescue or a medical emergency intervention. And those stats, they're so important and noteworthy. We just won an award from the American Association of Suicidology for Crisis Center of Excellence for 2022.
That's fantastic.
And at the ceremony, thank you. At the ceremony, I spoke to a suicide survivor who was just blown away by those stats and said to me, if more people knew that it doesn't mean when you call that, the fire department and the police and the ambulance are going to show up at your house. If more people knew that just talking to someone could help reduce their crisis state, I think more people would call.
That's for
And I
sure.
was taken back by that.
Well, it's a wonderful resource, and we're very lucky to have it here. And if we can help even one person right now, that's certainly a good thing. Tanya Barrett, the Senior Vice President of 211 Health and Human Services, thank you very much for joining us this afternoon. And again, such an important cause, a very important resource for everyone. And just a reminder as well, if you or loved one needs some help, we do have a link to the resources discussed today, a lot of information. You will find it posted right now on the Channel 3 app, including the phone number 211-1-800-HOPE-135 or 211.ct.org.